So what are the ways that we can contain the spread, saying that every day we keep getting more and more numbers of COVID-19 across the country? Joining us right now via Skype is Dr. Abdulaziz Bako. He's a PhD candidate, health policy management with the Indiana University. We'd like to thank you for joining us at this time.
Thank you very much for having me.
So, Dr. Bako, it appears to be a situation in the United States, and also compared with the fears of a spike in COVID-19 cases. Tell us how, indeed, the government there is trying to perhaps settle things with the protests that have been going on across the country, and then, trying to indeed stop the further spread of COVID-19.
A lot of states have started, or I think most of the states have started reopening their states. A lot of, worship places, businesses, and other places have been opened. And these are phased openings. They are very much dependent on how the infection is spreading, looking at how many people are infected every day, whether they are flattening the curve, which means that a decrease in the expected number of people that are going to be infected. So when you see that the number of people that are infected every day is decreasing, or the rate at which it increases is going down, then that gives you an indication for reopening the state. And they are doing a lot of random testing of people to understand sort of the prevalence of the disease. Indeed, these protests that are going on will definitely serve as a setback on the fight against COVID-19. But I believe that we will see the effect in the next few days, whether if there would be one.
Dr. Bako, are you surprised with the figures we're getting? Just as at today, at least over 5,000 more people in Africa tested positive for the virus. And we're looking at the highest in the region, North Africa, followed by West Africa. And the latest numbers in Nigeria, a little over 10,000. Are you surprised with the figures that we're getting?
I'm not really surprised. I think the numbers, especially for Nigeria, they could have been much worse because we are, of course, we are having low testing. That could be the reason. But then looking at the number of cases that are coming on every day. You would expect as I mentioned in our previous interview, you could expect that the doubling time was about 6 days, and then now it's much more than about 10 days, which is showing that somehow we are, doing well. That's optimistic, but I think somehow, the numbers, if we look at them, they're not as bad as we might think.
So if we're planning to ramp up testing, since we've been told testing is king, to know what, the reality of the people infected with COVID-19, and then we're adopting the best method, most reliable, what's your take on the use of the rapid test kits, which, the Medical Laboratory Society have banned, and the government, the NCDC, says is unreliable?
Yes, so there's a lot of issues about the reliability of those rapid diagnostic tests, and most of them are antibody tests. They are to show you if a person was previously infected or he is currently infected. So you might not know the positive test with those kinds of antibody tests. They don't tell you whether a person is infected right now. It could be that the person has been infected and they have recovered. So I believe that, having those two in hand or using them side by side would be really useful. And it's much better than having one.
All right. So moving ahead, perhaps your final comments. What advice would you give to some of the states that are saying, okay, it's high time, let's start to reopen the economy, and this is side by side with the numbers some of these states are recording?
I believe that, states should start thinking about how to reopen, because it's not a question of whether we should reopen or not. Especially we need to reopen, but we have to look at the numbers. We have to use science to guide us whether we should reopen or not. We should look at our exact, or try to randomly pick people and test them to see the true prevalence of the disease in our community, and continue the testing, contact tracing, and all the other stuff that the public health officials have been talking about that could be used to reduce the rate of infection.
All right, Dr. Bako, stay with us. We'll come back to you. We also have more states as they continue to ease restrictions of lockdown amidst the spike in coronavirus cases. Do join us again.